What is interesting from the studies that are coming out is that many of them across a number of countries in Europe, in the United States, in Asia, have found a very low proportion of the people that have been tested have evidence of antibody. And that is important, as you mentioned, because you mentioned this word herd immunity, which is normally a phrase that's used when you think about vaccination. And you think, what amount of the population needs to have an immunity to be able to protect the rest of the population. That level, we don't know exactly what that level needs to be for COVID-19, but it certainly needs to be higher than what we're seeing in some of these seroprevalent studies. What the seroepidemiologic studies indicate to us is that there's a large proportion of the population that remains susceptible. And that's important when you think about what may happen in subsequent waves or what may happen as a potential resurgence. And so we have a long way to go with this virus because the virus has more people that can be infected.
I'm just reiterating that herd immunity, and again, a term taken sometimes from veterinary epidemiology, where people are concerned in animal husbandry with the overall health of the herd, and an individual animal in that sense doesn't matter. Humans are not herds. So I think we need to be really careful when we use terms in this way around natural infections in humans. There was an assumption as this disease spread around the world that we're really just seeing the severe cases as well. The preliminary results from the seroepidemiologic studies is showing the opposite. It's showing that the proportion of people with significant clinical illness is actually a higher proportion of all those who've been infected, because the number of people infected in the total population is probably much lower than we expected. And as Maria said, that means we have a long way to go. And it means, as the Director General has been saying for months, this is a serious disease. This is public enemy number one. We have a second chance now, as a society, to put in place the necessary public health interventions, to put in place the necessary community supports, to support our vulnerable populations, be they in long-term care facilities or be they in refugee camps. No one is safe until everyone is safe. So I do think this idea that, well, maybe countries who've had lax measures and haven't done anything will all of a sudden magically reach some herd immunity, and so what if we lose a few old people along the way? I mean, this is a really dangerous calculation.
Having said that, we have the tools in our toolbox to be able to prevent this virus from taking off again. And we know that that's about finding the virus, finding people with the virus, isolating them, caring for them appropriately depending on their symptoms, making sure that we find all contacts, we trace those contacts, quarantine them so that they don't have the opportunity to transmit further, make sure our population is fully engaged so that they know how they can protect themselves and how they can protect others.